one of the 15 top health systems in the nation for the second year in a row.
Bipolar disorder is a serious mental illness of brain. Just like other medical condition, heart disease, more than 5 million Americans in United States have bipolar disorder. It consists of mood swings which involve major highs and major lows. There are two types of bipolar disorder. Type 1, where patient experience a manic episode, and the other type is called bipolar type 2, where patient experience hypomanic episode and depression. Bipolar disorder is also called manic depressive disorder, which was the old terminology which we are not using anymore, which is we are using bipolar disorder nowadays. The exact cause of bipolar disorder is unknown, but there are several factors which contribute in bipolar disorder. Genetic predisposition, it runs in family, abnormalities of brain, chemical imbalance in the brain, stress, abuse, psychological trauma. So all these factors contribute to either cause or put anyone at risk of bipolar disorder. In bipolar disorder, patient goes through major highs and major lows. When patient experience major highs, their mood is either irritable, agitated, or they are elated or euphoric. They are easily distractible. They don't sleep but have a lot of energy, unable to focus, grandiose behavior. They feel like they're on the top of the world. They engage in risky behavior like hypersexual, involved in gambling, shopping spree. They buy stuff which they don't need it. They are also involved in impulsive behavior like using more drug and alcohol. Their mind race 1,000 miles per hour. They are unable to focus, easily distractible. So these are some of the signs of bipolar disorder when patient go through manic episode. When patient goes through major lows, their mood is either depressed, hopeless, unable to concentrate, energy level is down, increased guilt, unable to sleep, or sometimes they sleep a lot. Their appetite goes down, they lose weight, or sometimes patient develop increased appetite and they gain weight. And when these symptoms goes on, they can have suicidal thoughts and they act on it. Patient who has bipolar disorder, if they don't get treatment on time, they are more likely to use alcohol and drugs. They are more likely to get into legal problem. They have difficulty coping at work. They ended up losing job. Their grades goes down and ended up failing an academic activity, relationship problem. We have so many patients who have bipolar disorder. They either ended up getting divorced, separated, breakup. So it affects relationship. And if they continue to experience bipolar symptom without treatment, they are at highest risk of either hurting themselves or others. So suicide is one of the complications of untreated bipolar disorder. Untreated bipolar disorder cause multiple complications. One of them, patients are more likely to use alcohol and drugs. They ended up losing job. Their performance at work and at school goes down. Relationship problem, patient ended up getting either divorced, separated, or breakup. Legal problem, patient who don't get treatment for bipolar disorder, they get into legal problem. And if it continues, patients are at highest risk of suicide. They either hurt themselves or others. If you have bipolar disorder and experiencing those symptoms, please call your primary care physician or counselor, therapist, or psychologist or psychiatrist. But if you have suicidal thoughts or thoughts of hurting others, please call 911. The good news is bipolar disorder is a treatable condition, just like diabetes and heart disease. There are safe medication and psychotherapy. So if you have bipolar disorder, please seek help and see your physician, because medication and psychotherapy will help your bipolar disorder and help you to get back to normal life.